All right, guys. Hi, Jason Emer from Beverly Hills. Everyone keeps asking me about the under eye. I've somehow become a leading expert in under eye filler treatment, which I love to do. And ever since we were on the doctor show showing the difference between cannula injection and needle, we decided to make a video, which we posted today, and now I'm going to show it live. Using Belotero, which is my favorite under eye filler. It's actually not approved for the under eye. There is no filler that's approved for the under eye. But we use different types of filler under the eye to give improvement in dark circles and hollowing. We've already injected this patient. We knew that he's going to need more than one syringe to this area because he has some facial volume loss, but we've gotten a lot of improvement now using radius to the midface to give lifting and a little bit of Belotero. Now we're going to fine tune it by adding a little bit more so that he can avoid having to have surgery in the under eye, the eye bags and that sort of thing, which is a surgical procedure. We can just give him the improvement he wants so he doesn't look as tired, and like his people have said to him, he just looks younger and it looks like he got a haircut. No one knew he had anything done, which is great. So I'm going to show you first cannula injection, and when you can see here just a little bit of hollowing here. Look all the way up with your eye and you can see the eye bags kind of pop out. So there's a couple ways to do it. You can go multiple directions. We're going to come from a little lower today. We're going to use a 27 gauge cannula, and this allows us, you can see the cannula here is blunt, so when you touch the end of it, it's not sharp. But we make one little entrance site, and then we go under the skin, and we've done this on TV before, and you can see where the cannula is. It's in the area that he has the eye bags, and we're just going to give him some volume. Now we don't want to do, the reason I like this filler here is it doesn't have a lot of swelling. It's very soft. It's great for men that don't want to have want anyone to know that they've had a lot done or had anything done, and it just allows us to give a subtle improvement without a lot of complication or risk. And we're using cannula to show it being placed much easier than using a needle, plus the pain is decreased significantly as opposed to when you use a needle. And so we're going along the orbit here. We're just basically injecting a little bit. So look all the way up now again, and you can see now the eye, where that the bag is a lot more covered, okay? We just massage a little bit in there and let him hold. We'll have him hold right here for a minute, and we're gonna go to the other side.
There we go.
And we're gonna go to the other side and do now cannula as well. Okay, hold that here, good. Look all the way up with your eye, perfect. We're gonna do that same thing again, from a little lower position, perfect. And we're gonna go directly in to the trough, you can see there. And we're just gonna give small aliquots. Don't wanna do too much, just very small bits to give support. You're doing great. Okay, now look all the way up again. And you can see how you don't really see now the trough as much. The goal is obviously not to overfill because we don't want any swelling here long term. But we like this filler a lot because it helps define lines and it's very, very soft. Doesn't have much swelling at all. Great. So look up again. Perfect. Okay. Perfect. So hold a little pressure there. We're gonna go to the other side. And now what I'm gonna do is fine tune with a couple needle pokes. So the difference between the cannula and needle is that the needle obviously has, a sharp end, so there's potential for more bruising. However, we can get to these fine areas. Look all the way up with your eye. You can see up in the eye corner where he is a little bit more challenging to get precise injection of the cannula. And here now with the needle, we can get the really precise superficial injection you could see these little blebs. And those will disappear. In time, we just do a little pressure, and basically there's numbing medicine inside here. Smile for me. Perfect, relax. So we're doing improvement of the fat pads under the eye, as well as just the hollowing of the circles themselves.
Dee Dee asks, is it painful?
How does it feel?
It feels fine, yeah.
Little pinches or?
Little pinches like acupuncture.
Okay.
What's the first injection?
The cannula.
Yeah, I didn't feel that at all.
Yeah, usually you don't feel that at all, which most people love, but to be able to really get the look that I want, and for him I know, you know, he just wants to look younger, look a lot of refreshed. People don't know. We're kind of having to do this sort of combination, but that's the difference. You know, with cannula, you can get larger volume areas, it's less pain, but here now I'm doing microscopic, we call it micro depot injections, which are little pinches to go a little bit more superficial, to get a little bit more of the crows, to get a little bit more improvement in the hollowing. You just got to do very small injections. Now, people will most likely get bruised from it. Within a week or two, it'll be gone, but the results will last about 6 to 9 months, which is great.
Do you numb prior to injecting?
Yeah, we do numbing, we do icing, we do shoulder massaging, we do everything that we can to make it so it's at least somewhat pleasant. Again, we're going to fill the hollows on the corner of the eye, as well as the deeper fat pockets. And you can see when you do this both kind of deep and superficial injection, you get a much more improvement in the look of the trough in the eye itself. All right, one more. Okay, perfect. Okay, close your eye, hold right there. Great, let me see the other side now. And we're pretty much done. Let's take a look. Great, I'm just gonna do a couple deeper injections here. This is sort of the fine tuning. Look all the way up again. Great. Doing great. Doing great. And the key with this filler is you do little baby injections and then you hold some pressure so that it integrates into the tissue. This is one of the few fillers, go ahead and close, you're finished. The few fillers that actually integrates directly, yeah, I'm gonna do a little here, into the eye itself, into the skin completely evenly compared to others. And now what we're gonna do, he just has some, you know, some grooves here. So we're just gonna throw a few injections of filler in here. And this is an area where there's lots of blood supply. So you wanna be very careful about how you do the injections here. We do really very small amounts superficially, just to get a little bit of improvement. I'll come to the other side. Go ahead and let go a sec. Great. Perfect, okay. So now look all the way up with your eye, just look, and you can see, can you see a trough anymore? You really can't. Perfect. So in a couple weeks, we'll show the before and after, but I think everything is gonna look phenomenal, and that's the layering technique using both cannula and microdroplet depot injections of filler to get an improved result in the under eye. All right, take care. Yeah, I'm gonna show you your eyes because